My name's Chip. I'm from Ventura, California, and my daughter Emily, who's 16, is having her second lipedema surgery today. Really interesting to learn about lipedema and what it is, and to see how it affected our family. I mean, I think about my daughter. She was super active volleyball player, and you know, always seemed to move around a lot, but she started having pain in her legs, and it was really counterproductive, and we got very frustrated because she was working hard with nutrition, she was working hard going to the gym, I mean, really focused on fitness and health and wellness, and it just wasn't working for certain areas of her body. My wife Buffy was able to do some research and found out about Dr. Amron and lipedema, and it was amazing to me to see what really happened with me is when I found out and was educated on what lipedema was. Thinking back to all the people that I know personally, that I know for sure now have or had lipedema and are suffering through their life. And I think for me, mostly it was about kind of having a solution that was in front of us, and then just really taking advantage of it for my daughter and for her to have a better life. I mean, just to be comfortable in her own skin and not have pain. I think when Emily first found out that she had lipedema, I think she was probably relieved to know that there was something other than just her that was affecting this inability to not lose the weight or not get rid of these problem areas that she was really working on, and it was frustrating for her. So I think she was relieved when she first found out that lipedema was even a thing, and it kind of took it away from her having to own all of that to go, wow, you know, there is a reason that I can't lose all this fat on my legs or all this fat in my arms in just these certain areas. I mean, when you watch someone work really hard and have great results in all other areas of their body or in whatever, she's always been very goal oriented and accomplishes her goals, and to not be able to get to that one piece was just super frustrating. So I think she went through a little roller coaster of ups and downs, and you know, ultimately was just really stoked that there was a solution. Well, I just think it's awesome what Dr. Amron's doing here, trying to spread the word and educate people on lipedema. And you know, just as recent as yesterday, one of Emily's teachers was asking questions about this, and very inquisitive to the point of maybe overstepping a little bit and asking, well, you know, how come you didn't just lose weight? Or how come, you know, just the common questions that you would get from people that don't understand this. And come to find out, she was inquiring because she thinks her sister has lipedema. And you know, as far as lipedema awareness, I think everyone should try to understand this, and if you know people that are suffering from this, maybe let them in on it and share what Dr. Amron can do, because it's a lifesaver. And I think just the pain that's caused from this alone, it's so important to try to help people through. But you know, I guess it's just the solution now, which is really a great thing.
So we just got out of the operating room.
How'd it go?
Great. Your daughter is amazing. The first one we did under anesthesia, right? A couple weeks ago?
Yes.
Yeah.
Yep.
She was really nervous and anxious about
Yeah.
the whole thing, and I think she realized it wasn't that bad of a process, and she was great with this. And actually, you know, we videoed some stuff with her in the operating room, and you know, we asked her, so what do you feel? And I think her answer was zero. I feel like nothing.
Wow.
With it. So
That's
she was
amazing.
great. But she's also she was very calm with it. The surgery went great. Today was calves and ankles and arms. She'll get a great result. She'll be ready to go in about 15 or 20 minutes.
Oh my gosh.
I think that's a testament to your method, procedure, I don't know what you would call it, but we also talked to the MLD therapist that did her.
Spoke very highly of it.
Yeah, and she said that was sort of a common thread. She feels like just your work is just really, you've got a magic touch on it.
Yeah,
and that made us feel comfortable and confident.
The biggest thing for me with the lipedema is when I heard you say that really there's nothing else, there's no other solution than this. And that immediately made me, say to Buffy, well, we have to get this done. I mean, this is our kid.
Well, there are a lot of things that can help. I mean, certainly diet's important, exercise is important. I'd say that they don't help at all. And there's supplements that can help, and there's compression therapy for the swelling, but you really have to go in and restructure it and remove the fat, because that's really the basis of the problem.
Yeah, I mean, it's so clear in the picture, the disease fat and the difference. It's obvious.
Yeah.
Well, and again, at her age, knowing that this is sort of a progressive issue, we don't want to just sort of maintain and watch it progress and watch her go to, stage 2 and stage 3 and have lack of mobility and more pain when it's something that, we can address now. And she'll probably have to continue to stay on top of the MLD therapy. And I know she's very conscious of like an anti-inflammatory diet, but those things are so much work for so little help and so little results.
That is true. So you didn't hear me say this, but I said this to them in the recovery before the surgery. Your parents are amazing. They really are. I mean, your parents.
You hear that?
You can kind of read people. I mean, I think especially as a doctor, you get to really reading people, and you kind of do the first few seconds. You take in their energy and their eyes and the tone of their voice and all that stuff. But I right away like them. But they, the more and more I am with them, they're just amazing. They're caring. They're incredibly caring.
Yeah.
So much so about the two of you guys. They're cool too.
I know that you're a rare commodity. How many doctors in the United States are actually doing this? Like, you focus only on the lipedema, so.
It's the vast majority of my practice. I mean, it's about 80 to 90% of my practice. I mean, kind of so much so that I'm not doing as much of the other stuff, and I really still love the other stuff too.
Sure.
It's the artistic thing, even with side street bikini models and all this stuff, and revision work that I do. But to answer your question, there's about four to five of us in the United States right now.
Wow.
And it's something that I think in a way should increase the numbers, but it's something that I don't want to see increase too quickly.
Right.
And I think you've got to have the right number of things, the right kind of integrity about things, the right heart in caring for the community. It's not about the money. It's about it's certainly experience and technical things. It's not straight ahead liposuction. It's a much more complicated area. It's calves and ankles, like we just did in her circumferentially. So, it should be a slow addition to lipedema surgeons. Actually, I was to establish a society for lipedema surgery in the United States, where surgeons kind of are trained in a certain way, understand the condition itself, the pre-care, the post-care, all the.
Well, that was the thing. Like, her normal doctors really had to. Luckily, we have a great doctor, and she was willing to actually do her homework, which I was really impressed by.
Thank you very much. I think a lot does have to do with approach and technique. The way of going about it, and it starts in the consultation with the patient. The rapport you develop, the way you view things from the standpoint of how to approach and target. It gets into how you kind of do your markings in areas and your approach in the area technically in a certain way. But a lot of it's just a matter of following that layer of fat very precisely all the way around. And I actually mentioned to Emily in the surgery, you kind of understand the benefits of having a conscious patient. Because you think about the calves and ankles, they curve that layer of fat very quickly. And I'm making fine adjustments to the patient as I'm doing
sculpting.
it. I keep on saying, she'll tell you, Emily, lock your legs, tighten your muscle, even in the arm, that the muscle's tight, so nothing's moving. If you kind of watch most liposuction, surgeon's just kind of in there and jabbing at things, creating a lot of imprecision. So that has to do with the precision removal of fat. It has to do with not traumatizing things that shouldn't be traumatized, like the muscle. If you think about it, you've got the skin, the layer of fat in the muscle. If you're not very precise and you're poking that muscle, you're just going to cause a lot of bleeding and bruising and pain afterwards unnecessarily. And under general anesthesia, if the person's really completely out, you don't have that feedback. If the surgeons that are, if the patients that are general, the surgeon jabs with the muscle, you're not going to have a patient say, ouch. If I touched Emily's muscle, she'll go, ow. So it really is, it's a better approach. I strongly feel it is.
That's really cool.
I think
but we appreciate it.
You talked about the initial consultation. That was for us right away. You spent so much time with us, educating us, getting to know, Emily, and I think that's a big thing too with other physicians is just there's a lot of emotions tied to this condition because it's probably, I mean, and I think even for Emily being so young, and still it was emotional because it was like, this is a battle that we didn't realize that she had this underlying condition that was making it more difficult. And then I can't imagine people that have struggled with this for so many years.
40, 50 years.
And as a physician,
ridiculous.
if you're not somewhat sensitive to that, you know, I mean, that it just seems like a different thing than just somebody coming in for a cosmetic procedure.
It's not cosmetic. That's what I was gonna say, is because, you know, I've recently lost weight and stuff, so I've been going to plastic surgeons. And this one doctor that we went to just for a consultation, he like does liposuction, right? He does plastic surgery and liposuction. He had no idea, he had never heard of lipedema. He said, oh, like, is it like lymphedema? Something like that. They hardly knew what that was. And it was like, oh my gosh, you know, it's definitely not so much cosmetic. Like, it's a different realm, I feel like, from the cosmetic. Like,
Sure.
Yeah, it requires a level of
Yeah, back to the
sensitivity.
consultation, I will
with
say
that.
that I did a radio show for 2 years, every week for an hour, live show, to talk about all these different aspects of concerning trends in cosmetic surgery. And one thing I would say is that in terms of like choosing a doctor, which is always a hard thing to do, it's not who's always in Beverly Hills, who charges the most, who a friend that refers you to who's been on TV or not on TV. But pay attention to consultation. I would say that a lot. Like really pay attention to how the surgeon's going with the consultation. They're like, oh, you know, you look great, don't worry, you know, you're kind of rushing through things. Or are they really going into detail about things? Because generally that's going to translate to the way they approach the patient in all the care. Pre-care, the surgical procedure itself, and afterwards too. Okay, how do you feel? Good?
Okay, yeah.
Okay, great. Everyone, great. So anyway, we went over the aftercare instructions. I will see you tomorrow, right?
Yes.
And husband went back to Ventura.
Yeah.
Go back after work.
Okay, all right, great. Keep going. Right, you're a great patient. All right, take care.
Thanks for everything. Really appreciate
I have to give you a hug too.
it. Thank you, Dr. Amron.